Managing AdvancedMD workflows entirely in-house has slowly evolved into a compounding financial drain for most modern medical practices. The people you need to run this system effectively aren't generalists. They require a highly specific mix of platform expertise, clinical operations experience, and deep HIPAA literacy to keep things moving. But that exact profile is genuinely hard to find and even harder to keep. Medical Group Management Association data from both 2022 and 2025 consistently identifies front office and medical assistant roles as the single biggest turnover hotspots in healthcare. This diagram illustrates the reality of those numbers. Business operations support staff face a baseline turnover rate of roughly 33%. When that seat suddenly empties, the workflow breaks. The friction hits your practice immediately. Claim denials go unworked. Scheduling bottlenecks quickly build up at the front desk, and patient calls sit unreturned while the rest of your staff scrambles to cover the gap. And an empty seat is expensive. According to the Society for Human Resource Management, replacing a single employee costs a business an average of 6 to 9 months of that person's annual salary. If you are a practice manager constantly cycling through administrative staff, you aren't failing at recruitment. You are participating in a structural bidding war against large health systems and outside industries that a smaller practice mathematically cannot win. To understand exactly why small practices lose that bidding war, we have to look at the fully loaded cost of a US-based employee. The baseline salary you put on a job posting is only a fraction of the actual financial burden on your operations. This chart shows hidden costs stacking up. Starting from a $35,000 base salary, you add benefits, payroll taxes, training, office equipment, management overhead, paid time off, and turnover costs. The actual demand is $60,000, $800 every year. But the cash is only part of the drain. When your administrative layer is understaffed or constantly turning over, that workload doesn't vanish. It travels up the chain directly to your clinical team. American Medical Association data shows physicians now spend an average of 13 hours per week on indirect patient care tasks, including EHR documentation. In primary care settings, the numbers are even tighter. Studies show physicians spend an average of 36.2 minutes on EHR activity per patient visit, which is often more time than the actual clinical encounter. That $60,000 cash cost is only the visible burden. This model directly consumes billable physician hours and erodes the quality of patient care. Because of this math, over 800 practices across the country have chosen a different route. Instead of cycling through local generalists, they completely remove their AdvancedMD workflows from the physical office, contracting with a healthcare-specialized outsourcing firm like Staffingly. Staffingly assigns dedicated, full-time specialists to your system. Unlike a shared support pool, these virtual medical assistants work exclusively for your practice. This entirely solves the local training burden. Your senior staff no longer has to pause their own work to teach a new hire, because VMAs arrive already fluent in the AdvancedMD platform and the clinical context behind your specific workflows. A traditional local hiring process easily consumes weeks or months before a candidate is productive. A dedicated VMA can be deployed and go live in your system within 48 to 72 hours. From there, a structured onboarding pipeline means most practices reach full operational integration with their new remote team in just 14 days. There are also no long-term contracts trapping you into a specific headcount. If your practice grows or seasonal volume shifts, you can scale the coverage up or down with 30 days' notice. You trade the traditional comfort of having a physical person at the front desk for immediate deployment speed and the complete elimination of your local training cycle. It is natural to be skeptical about quality control when staff isn't sitting down the hall. But the labor cost advantage of outsourcing is actually secondary to the operational infrastructure supporting the work. Staffingly supports every VMA with a 3-layer human management structure. A team leader handles daily supervision, a process manager audits for quality, and a customer success manager serves as your dedicated point of contact. This removes the management burden from your shoulders. Instead of micromanaging daily tasks, practice leadership simply reviews structured weekly reports to see exactly what is happening. Staffingly layers AI automation over the human workforce. Smart routing evaluates incoming scheduling, billing, and claims tasks, instantly sending them to the right specialist. Simultaneously, AI trend analysis scans AdvancedMD data, surfacing patterns like claim denial clusters weeks before a human catches them. The system also runs continuous service-level agreement monitoring. It tracks turnaround times in real time and flags items approaching their deadlines to ensure no task falls through the cracks. And through continuous calibration, the AI adjusts those workflows based on past outcome data, meaning the system actively becomes more efficient the longer you use it. This model functions as an engineered, self-managing workflow system. It lowers staffing costs while building a structural defense against human error. Of course, operational efficiency means nothing if your data isn't secure. We have to evaluate the most critical risk factor in medical operations: digital security and strict HIPAA compliance. Building a comprehensive, impenetrable digital security framework from scratch is a massive vulnerability for an independent small practice operating on a limited IT budget. Here we see the enterprise security stack provided by top-tier outsourcing firms. Partnering with an established firm gives you immediate access to these credentials, starting with baseline HIPAA certification, but it goes further. Badges like SOC 2 Type 2 and ISO 27001 require rigorous, independent third-party audits that continually verify exactly how patient data is being handled and protected. Adding HITRS alignment provides the absolute gold standard of healthcare data security. This is a level of protection that mid-size practices rarely have the budget to build independently. Beyond digital security, there is an operational safety net. The VMA model includes built-in backup coverage, ensuring that sick days and unexpected absences never stop your claims from being submitted or your reports from running. Partnering with an outsourced firm acts as an immediate upgrade to your practice's security posture, effectively offloading heavy compliance liability to a certified partner. Now, let's look at the bottom line. Earlier, we established that the fully loaded cost of an in-house administrative employee sits at roughly $60,800 a year. This diagram compares that to a dedicated Staffingly VMA. A VMA runs at a flat monthly rate of $1,800 for 45 hours a week of coverage, totaling $21,600 a year. That $21,600 figure is completely all-inclusive. It covers all benefits, payroll taxes, specialized training, backup coverage, and the entire management infrastructure. The math is straightforward. Switching to the outsourced model yields an annual savings of $39,200. That is a 64% cost reduction. If you run a slightly larger operation and replace just 2 administrative positions, you are putting nearly $80,000 back into your practice budget every single year. Migrating your core operating infrastructure to an outside team can feel complicated, but the data clearly shows that maintaining your current in-house model carries a far greater operational and financial risk. If your practice is bleeding margin to continuous turnover and losing billable physician hours to administrative documentation, outsourcing your AdvancedMD workflows is the most mathematically sound decision available.